Joseph Cardinal Bernardine best expresses our challenge and moral calling when he said, "Healthcare is an essential safeguard of human life and dignity, and there is an obligation for society to ensure that every person be able to realize this right." Cardinal Bernardine's thoughts are not liberal or radical, for they echo the words of our founding fathers in the preamble to our Constitution when they wrote, "We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America." The framers of our Constitution set out to explicitly design a national government where the establishment of justice was one of its first and foremost concerns. A nation of justice and fairness, which today should include all Americans. I believe that government which governs least governs best, but government must govern. I believe that the primary function of government is to do those things that the private sector cannot or will not do. In the area of health care, we've given the private health insurance companies over 60 years to provide adequate, affordable coverage to all of our citizens, and they have failed. They've had their time, they've had their chances, and their time is now up. It is now our time. Those of us who believe in justice and will not rest until it comes. That is why I believe you will help spread this message across our country. For we are a people thirsting for new dreams. We are a nation hungry for a person of vision, integrity, and courage to speak the truth and show us new levels of individual and social living, grounded in the simple principle that we can have adequate and affordable health coverage if we, individually, give up a little to gain a lot together. And so, we arrive at a great question. How much longer can this nation tolerate our current healthcare system to continue? Where employers bear the brunt of the cost of health insurance, the working class American receives less coverage, where doctors are treated as investors' tools, and where a large slice of your premium dollars are skimmed off for top executives at the nation's largest health insurance and HMO companies. Hopefully, with your help, the answer is not long. Generation after generation of working class Americans have watched as every one of our cultural, military, and main trading partners have instituted some form of a national health care system to provide adequate and affordable medical care to all of their citizens. Yet, still America waits. We started talking about national health care over 60 years ago when my grandmother was a very young woman. Recently, she died in her 80s, and still we wait. My mother was born in 1951. She was forced into early retirement, and recently her life gave way to the effects of emphysema, and still we wait. I was born in 1961, and am now just beginning to enter middle age, and still we wait. How long must we wait? How long can we wait? How long will we wait? The answers to these questions are yet unknown, but I do know this. We who believe in justice will not rest until it comes. In 1927, Louisiana, the state I was born and raised in, faced enormous issues of justice and fairness. It was a state of these United States where more than 40% of the population, black Americans, was denied basic civil rights, and where many working class citizens, black and white together, suffered horrible conditions of poverty in a state sitting on some of the richest oil fields in the world. The working class citizen looked around and saw great inequities there. They saw the haves becoming have-mores. They saw a government which no longer seemed to work for them. They saw that success came to the well-connected, while falling behind came to them. They asked how could such conditions exist in the United States of America, and they longed for someone to come along and speak to the injustice they saw. They waited for someone to address the lack of schools for their children, the unpaved roads, and the unfulfilled promises of hospitals and adequate medical care for their families. These dirt poor people had waited for such a long time until their discontent became despair. But out of this misery came a politician, a man, who tried to address their concerns and alleviate their anguish by reminding them of who they were and what they were as Americans. While campaigning for the office of governor of the state, this man talked about Longfellow's famous poem, Evangeline, the moving story of Evangeline and her lover Gabriel. The poem recounts the tale of two young people in love, but tragically forced to separate on their wedding day when the Acadians were driven out of Canada and dispersed throughout North America. Evangeline and her family made their way to southern Louisiana, where the beautiful young woman, though separated from her lover, faithfully waited under an oak tree in the little town of St. Martinsville, or so the story goes. Evangeline waited days, then weeks, then months, and finally years for her lover Gabriel to return, but he never did. Over 75 years ago, Huey P. Long told a large multitude gathered under that same oak tree of how Evangeline had waited there and had cried bitter tears. Her tears lasted a lifetime, but their tears and cries for justice had lasted generations. He asked them to join with him in a great and noble movement for social change and justice. They did, and Louisiana was transformed. Today, I'm asking you to do the same. I'm asking you to help transform America, our country. I'm asking you to come and join with me in a movement for social justice and change. I'm asking you to help make my vision of all Americans having adequate and affordable health care a reality. I'm asking you to keep in mind that we're all in the same boat, cut from the same American cloth, and heirs of that great can-do spirit which has characterized all who've touched our nation's shores. I'm asking you to accept that we are the generation of Americans tasked with the mission of solving this crisis in health care. And we simply cannot fail to answer this call, because if not us, then who? If not now, then when?